On the 23rd of March 2020, when President Cyril Ramaphosa addressed the nation and announced that the 21-day lockdown would begin at midnight on Thursday, the 26th of March, and then conclude on the 16th of April, none of us really knew that our lives would be forever changed by what would be known as the COVID-19 pandemic. In his book, Standing Up for Science, A Voice of Reason, world-renowned clinical infectious diseases epidemiologist Professor Salim Abdool Karim gives us a personal, behind-the-scenes account of the first 3 years of the COVID-19 pandemic. He confronts some of the controversies in the science-to-policy process, drawing lessons from COVID-19 to prepare for future pandemics. Professor Salim Abdool Karim joins us virtually to speak about the book. Professor, it is so lovely having you. Congratulations on the book and welcome.
Thank you very much, Leah. It's a great pleasure to see you, and a very good morning to you and the viewers.
It's a pleasure to see you and not be speaking about the pandemic and living in the pandemic. So it's nice to be talking about it basically now in hindsight, which I think is going to be exceptionally interesting, which you have documented in your book. I mean, you're a highly respected global scientist and a clinical infectious disease specialist. I mean, that's what you do. Where did the love for science actually begin for you?
Well, it started when I was in high school. That I had a superb physics teacher, a chap by the name of Mr. Kasim Sidat, and he just sparked excitement about science. And so I used to meet with him after school for about half an hour, several times a week, and we would talk about science. And in all of that, I became completely enamored with the history and activities and the science of Sir Isaac Newton. I began reading about how is it that, he came to make these laws that define how our world works. And in all of that, it became clear to me, actually, his major discovery occurred because of a pandemic, that there was this pandemic of infectious diseases, most likely flu at the time, and he was sent home from Cambridge. Cambridge University was closed and all the students and staff were sent home. So he went home, and while he was at home, he decided to go and sit in his family orchard, and he was writing under the tree when the apple fell. And he asked the most profound question, why did the apple fall down and not up? And that's, the rest is history. We understand and know, how profound his laws are and how much science now began to explain the world, to help us understand it.
Yeah, and boy, if ever there was a time where people were forced to become their own form of scientists, which was a good and a bad thing at the time, it was during the COVID-19 pandemic. And, this is where we really took scientists and were literally looking to anybody that had knowledge of any form of disease, of a pandemic, of how this was working, and to try and get our heads around this. So this is where I want to land, because there is so much to speak about, including your work in HIV and AIDS, but we'll probably get there. But I want to talk to you about the first time you started seeing this sort of funny virus doing its round in Wuhan, and we started hearing the rumblings at the end of 2019. I know you were on holiday with your family. That was when you started getting word of it. Perhaps let's hear from your mouth as to what that was like for you.
We try as a family to go at the end of the year somewhere, just in South Africa, usually. Went to Orabi Gorge the year before, and that year in 2019, we decided we were going to go to the Drakensberg. And so we went there, the whole family was there, and we were at the Cleopatra farmhouse, and we were walking on a trail in the mountains. And while we were doing that, I got an alert, a ProMed alert on my iPhone. Now, when it beeped, I stopped on the trail, and I looked at my watch, and it said, ProMed alert, undiagnosed cases of pneumonia in Wuhan, China. Now, I saw that, and I didn't really give it a second thought. I said, what is this? Pneumonia in China? Probably SARS. Chinese have dealt with it before, not a big deal. And I just carried on the walk. I didn't give it a second thought. But what happened was a week later, when I was in my office, Professor Tulio de Rivera, whose laboratory and office is one floor below mine at the Nelson Mandela Medical School, he comes up to my office and he says, "Have you seen this? Have you seen this? It's the sequence of the virus is on Twitter." I said, "Twitter? I mean, who puts science on Twitter?" And he says, "No, you must see it. It's got a link and you can see the whole." So we did that. And at that moment, it became clear to me that we were dealing with something that was going to be very unusual. And that was the start of my understanding. And initially, I was in a bit of denial. I said, oh, maybe, the Chinese will contain it. They contained SARS and they were able to do this. I was, not really accepting of it. But by mid-February, it became very clear that we were dealing with a crisis. We had to take leadership. We converted our lab. We were doing COVID testing well before the first case even came about.
Yeah, which is fascinating, and you talk us through that as well. And you also talk about the moment where that pang of anxiety came to you, and you started really worrying when you saw research being done by one of your sort of associates or somebody that you do know that was saying that this could cause death in 1 in 40 people around the world. I mean, having a statistic like that, and then looking at the Africa story, and of course bringing your work in HIV and AIDS into it, this is where alarm bells, I imagine, started going off very loudly for you, and you realize that this is bigger than any of us actually realize.
So the individual who I've known for many years, he's the head of AIDS research in the China CDC. His name is Zunyu, and his surname is Wu. So Zunyu Wu and I have been in, we serve on committees together, known him for more than 2 decades. He's a brilliant scientist. And when he published his paper in the Journal of the American Medical Association, and he showed for the first time on a large scale what the impact is, and when he showed that this was the number of patients we were likely going to see in our ICUs, and this is the death rate, I mean, a quick extrapolation, that's a crisis.
Yeah.
This is not something that you can just, wish away. This was going to be something you're going to have to deal with. And so I called him. I got him on the phone. I said, I need you to explain to me. And so we chatted, and it became very clear to me his data was sound. I needed to take it seriously, and we needed to get ready.
Sure. And boy, were we starting to get ready. I mean, that was where, and of course, I mean, we all remember, it was on the 5th of March, 2020, when the very first case was found here in South Africa. Until then, we were just seeing it around the world and saying, okay, well, we don't have it yet. And then, bang, it landed, 5th of March, 2020. And then by the 15th of March, the president declared a state of disaster, and South Africa had only 61 cases of COVID-19 at the time. I remember asking friends overseas, do you know anyone who has COVID? What is this thing? Do you know? I mean, we're all sitting at home and we don't even know what it looks like. But, the WHO had declared this a pandemic, and the world came to a standstill. But there were still mixed messages coming out from around the world. You obviously being more in the know, but as a normal layman, I imagine it was quite frustrating seeing people sort of doubting that this thing even existed. What was it like trying to speak to people that know nothing about this, and particularly naysayers?
Right. In any situation when you're dealing with a crisis or potentially anxiety-provoking situation, you will get deniers. It's, people deal with all kinds of personal crises in that way. Their first reaction is to deny the problem even exists. It's how they deal with it. And so, many of the people who were writing to me were not sure about where things were, and some of them were in denial. Some of them were just unclear. Some of them were panicking. And so I had the full spectrum of responses. People were trying to get understanding of it. And what became clear to me is that we didn't understand enough, and that lack of clarity was a bigger problem than the virus itself. the fact that there was this lack of information, and that what was being shared was, the images on our television screens was of, Italy in crisis, patients dying all over. That image was conjuring up in people an anxiety-provoking situation. But it was science that helped sort that out. Yeah. It was, terrific research being done by people like Zunyu, who provided us with the actual data and provided us with what the situation is, so we can calmly look at this problem, understand what needs to be done, and start doing it and preparing for it. And that's exactly what happened.
And that's exactly what you did, because I remember it so clearly. I mean, none of us will ever forget that 23rd of March 2020, that was when the president said, 21 days, COVID-19 lockdown. Little did we know that we were going to be locked in our houses for months, but that's another story, because a couple of hours before that, you were actually appointed as the chairperson of the Ministerial Advisory Committee. I mean, this was a role that was not only meant to be an advisory role, but you basically became the scientific face of finding a solution to COVID-19 for South Africa and the global community. I mean, you would have to deal with politicians, which I can imagine is not easy. But you had to deal with people and politicians and science and keep the nation calm. And that was the one thing I found about you. It was the moment you started speaking, it was almost like, oh, okay, I get you. You took all these things that as scientists you think is normal, but us normal average South Africans and people don't understand scientific terms, but you brought it down to our level. So that was very, very comforting, and we thank you for that. But, in terms of juggling everything I mentioned and the memories of those early first days as the MAC chairperson, what was that like for you?
Well, so I've been called by the Office of the President to come and just provide a bit of advice and so on, but nothing of a significant nature. But it was on the day that the President announced the lockdown that the Minister of Health called this virtual meeting by Zoom of 50-odd scientists, and that's when he created the Ministerial Advisory Committee. And it was at that meeting that he announced that I would be the chair. Now, he hadn't asked me, and he didn't need to. I would do it, obviously. But in taking on that responsibility, he required me to start ensuring that I was providing information that he could understand, that he could act on, and that government and the civil society were informed and could make informed decisions. And it was in that Easter weekend, it started off with a presentation the minister asked me to do to the Parliamentary Portfolio Committee. And he enjoyed the presentation so much that he said, no, can you do it, tomorrow on Saturday to the cluster of ministers? And, one thing led to another. And by Monday morning, Easter Monday, he asked me to brief the president, which I did. And the president says, no, the public needs to hear this. That this is information that we have to share, and you're going to have to share it today. And so that evening, he asked the minister to set up that televised presentation, and that's when I did the presentation. And of course, I've never done a presentation like this on television before. Yeah. And so I'm sitting there, I'm doing my presentation, and I'm about 12, 13 minutes into my presentation, and they lean over and says, nobody can see your slides. And it occurred to me, of course, I didn't think about it. The television cameras are focused on me, not the slides. And I needed to stop. And the television cameras needed to be told, actually, don't put the cameras on me, put it on the slides. Yeah. And so I had to start again. And it was just such a new experience to be doing a scientific presentation on national television. It was a completely new experience for me.
Well, I know. I mean, it is. I mean, it's like me suddenly becoming a scientist when I do know TV. That's what I really do know. But I mean, it must have been, listen, at that time, we had nothing else to watch. So we could have just looked at you and listened to you. I mean, that was all we did. We all stopped dead in our tracks, and anyone that could explain something to us was very welcomed in our houses. you stepped down from the MAC after a year to focus on your academic work. But before then, you found yourself working closely with, as I mentioned, politicians, and some actually labeled you Dr. Death. And at some point you were described as being a failed advisor. I mean, as someone whose work is centered around science and evidence, what did these negative comments do to you and to your family? I mean, because it was a very difficult time during COVID.
I think in the nature of being and sharing bad news with the public, one has to expect that some people will react badly and react negatively. That didn't particularly bother me. And, for example, the EFF, when we were promoting the idea as the MAC, that the schools should reopen, the EFF, called me Dr. Death on television. And so it doesn't really bother me to get those kinds of things. What hurts me and what concerns me is when they target my family. Mm-hmm. And, that's what started happening. And I think that was just unfair. I don't have a problem if you disagree with me, and not a problem, but when you start attacking my family as a result, I felt that that was hurtful. Overall, I think, the vast majority of people wanted to understand. And my job was not to tell them what to do. My job was to tell them what is it we know, what is it we don't know, and what are the courses of action that are available, so that people can make their own minds up. They don't have to do anything I'm saying. They just have to understand the underlying reasons for a course of action. So they choose to do something that might harm others. Yeah. That's their choice to do that. It's not because I'm not forcing them to do what I'm saying.
Yeah. Hindsight. Let's wrap this up with a look at hindsight. Did you have a role in the banning of cigarettes and alcohol? Is there anything that you would have done differently? Let's put it that way.
So I had nothing to do with it. And I was just as surprised as everyone else that cigarettes and alcohol were banned. Yeah. But once the data became available, it became very clear that the restrictions on alcohol became really important. And there's a very simple reason. Alcohol led to violence and led to motor vehicle accidents and so on. They were using the same healthcare facilities that we needed for the COVID patients. They needed ventilators, they needed oxygen, ICUs. And so the restrictions on alcohol, even though I had nothing to do with it, I strongly supported it when I started seeing the data. So whoever made that decision, I felt made it, without that knowledge, but that was a pretty good decision now with hindsight. Yeah. Unfortunately, with cigarettes, it didn't have the same benefit. So the banning of cigarettes was didn't have any particular benefit. It was an inappropriate decision, and it was never done again, thankfully. Yeah,
and I imagine banning culottes as well was also a problem in open-toe shoes. But that's just another story altogether. Prof, I've loved talking to you, and I know I can go on because this was what dominated our lives for well on 3 years, and this is a behind-the-scenes look for all of us to take a look and see what was going on. This was released yesterday, Salim Abdool Karim. I really am enjoying it, and I'm enjoying how it is just something that we can all understand as you write this. Thank you very, very much for joining us on the program. And of course, the Prof is South Africa clinical infectious disease epidemiologist. That was Professor joining us in bookstores around the country. You can catch it.